there's been a lot of controversy over the years over certain diets. Obviously, low-carb diets used to be an absolute no-no from ADA, but now ADA says, for some people it may work, that they're open to patients doing that if that's what works for them, and they can improve their health with it, then they're open to it. It's certainly not meant for everybody. There's no diet that's meant for everybody, just like you said. What is your philosophy when it comes to, and I'll be honest with you, most dietitians I've spoken to are adamantly against it.
The low carb. I think the challenge with low carbohydrate diets and what we found in the review is it's very hard to compare the different studies because one study defines low carb differently than another. And so I think there needs to be some more standardized definitions so we can compare the different studies. In terms of low carb diet for weight loss, for example, we in the nutrition recommendations tried to only look at studies that had data for 12 months and included an A1C at the 12-month period, and those that had an 80% completion rate. And in the studies that we found, none of the low carb diets had an 80% completion rate at the end, so weren't necessarily included. So it could be something in the study design. It could be that people couldn't maintain the low carb diet for a year. And so those studies aren't necessarily included. That doesn't necessarily mean that they're not necessarily good eating patterns to follow for weight loss. But I think when we look at all the studies, we really couldn't answer the question of which macronutrient composition is best for weight loss per se. I think that's a diet debate that we can maybe put to rest at some point in terms of that. I think in the end, it really came out strong is more about the energy restriction. People need the ongoing support. The more frequent contact you have, the more successful you'll probably be at weight loss. I think you need to choose something that you can stick with. And so I think, low carb ranges from, very small number of grams of carbohydrate to some people say like 30% is low carb. When we look at national surveys of what people with diabetes typically eat, it's about 45% of calories from carbohydrate that people report eating, and somewhere between 35 to 40% fat and the rest from protein. So I think people aren't eating, at least people with diabetes are obviously somehow getting the message to think about carbohydrates when they're self-reporting intakes in those national surveys. And I think when we looked at specifically low carbohydrate and just glycemic control, again, there really wasn't a specific amount that was best. So I think it's more about people developing an eating pattern that they can follow, titrating their medications with their eating patterns to manage their glycemic control and cardiovascular risk factors. So again, it's more about that individualization.